Every single night, millions of people over the age of 60 unknowingly put their heart under serious stress, and they do it while they sleep. You've probably never thought twice about the position you fall asleep in, but according to leading cardiac surgeons and sleep medicine specialists, one specific sleep position significantly increases the risk of heart complications, irregular heartbeat, and even cardiac events in seniors. Tonight, before you go to bed, you need to watch this, because what you're about to learn could literally save your life. Now, this isn't a scare tactic. This is science. Cardiac surgeons and cardiologists around the world have been studying the relationship between sleep posture and heart health for decades, and the findings, especially for adults over 60, are deeply concerning. As we age, our cardiovascular system becomes more vulnerable. Blood pressure regulation changes. The heart's electrical system becomes less stable. Blood vessels lose some of their flexibility. This means that the way you position your body during 7 to 8 hours of sleep has a direct and measurable impact on your heart's ability to function properly. So the question is, what is the one sleep position that cardiac specialists warn against? And more importantly, what should you be doing instead? The sleep position that heart surgeons most commonly warn seniors about is sleeping on your right side, and in some cases, sleeping flat on your back without proper elevation. Here's why. When you sleep on your right side, your heart is essentially shifted toward the right side of your chest cavity. This subtle anatomical change affects the way electrical signals travel through the heart. For seniors who already have any degree of heart disease, arrhythmia, or valve issues, this can trigger or worsen irregular heartbeat, also known as atrial fibrillation, or AFib. AFib is not a minor inconvenience. It is one of the leading causes of stroke in people over 60. A landmark study published in the Journal of the American College of Cardiology found that patients with heart failure who slept on their right side reported significantly more discomfort, irregular heart rhythms, and nighttime symptoms compared to those who slept on their left side. Now let's talk about sleeping flat on your back. For seniors with hypertension, sleep apnea, or any degree of heart enlargement, lying completely flat can cause the following: increased pressure on the heart and lungs, worsening of sleep apnea, which directly strains the cardiovascular system, a drop in oxygen levels during the night, elevated blood pressure upon waking. And here's the alarming part. Most people don't feel these effects while they're sleeping. They wake up feeling tired, dizzy, or with chest discomfort, and they blame it on age. But the real cause is their sleep position. Let's go a little deeper into the science, because understanding why this happens is what will motivate you to make the change. Your heart is located slightly to the left side of your chest. It is surrounded by a fluid-filled sac called the pericardium, and it is supported by a network of major blood vessels, including the aorta, the pulmonary arteries, and the vena cava. When you sleep on your right side, here is what happens internally. First, gravitational shift. Your heart is pulled slightly away from its natural resting position. The major vessels, particularly the inferior vena cava, which carries blood from the lower body back to the heart, can become partially compressed. Second, increased cardiac workload. Because blood return to the heart is slightly restricted, the heart must work harder to maintain normal circulation. For a healthy 30-year-old, this is barely noticeable. For a 65-year-old with any degree of arterial stiffness, this added workload matters. Third, autonomic nervous system imbalance. Research shows that right-side sleeping can shift the balance of the autonomic nervous system in ways that increase heart rate variability and promote arrhythmic episodes during deep sleep stages. Fourth, GERD and vagal stimulation. Many seniors suffer from acid reflux. Right-side sleeping worsens acid reflux, and chronic acid exposure near the esophagus can stimulate the vagus nerve, which directly regulates heart rhythm. This is a lesser-known but very real connection between sleep position and cardiac events. The bottom line? The right side of your body is simply not the safest side for your heart to rest on, especially after 60. So now that we know what to avoid, let's talk about what cardiac surgeons and sleep specialists actually recommend. The gold standard, left side sleeping. Sleeping on your left side is widely considered the most heart-friendly sleep position, particularly for seniors. Here's why it works. Better circulation. The heart's natural position is on the left, so sleeping on the left side allows gravity to assist blood flow rather than resist it. Reduced pressure on the vena cava. The inferior vena cava runs along the right side of the spine. Left side sleeping keeps pressure off this critical vessel, allowing blood to return to the heart more efficiently. Reduced acid reflux. The stomach's natural drainage angle favors the left side. This reduces nighttime reflux and protects the vagus nerve from irritation. Improved lymphatic drainage. The body's lymphatic system drains primarily to the left. Left side sleeping supports natural detoxification during sleep. And better for the brain. A study from Stony Brook University found that left-side sleeping may help the brain clear metabolic waste more efficiently during sleep, reducing long-term risk of neurological conditions. How to train yourself to sleep on your left side. Many people are habitual right side or back sleepers and find it difficult to switch. Here are 3 practical strategies. Place a firm pillow behind your back when lying on your left side. This prevents you from rolling over during the night. Use a body pillow between your knees. This not only improves comfort on the left side, but also aligns the spine and reduces hip pressure. Sew a tennis ball into the back of your pajama top. This old but effective trick makes rolling onto your back uncomfortable and over time trains your body to stay on the left side. Beyond sleep position, cardiac surgeons have a second critical recommendation for seniors, and that is elevation. Sleeping completely flat, regardless of which side you're on, can be problematic for seniors with the following conditions. Heart failure. Lying flat causes fluid to redistribute from the legs toward the lungs and heart, worsening breathlessness and cardiac stress. Sleep apnea. Flat sleeping worsens airway collapse, reducing oxygen delivery to the heart throughout the night. Hypertension. Some research suggests elevated sleeping helps regulate nighttime blood pressure more effectively. The recommendation from cardiac specialists is to elevate the head and upper body by 10 to 30 degrees during sleep. This can be achieved with a wedge pillow, available at most pharmacies and medical supply stores, an adjustable bed frame with head elevation capability, or simply stacking 2 firm pillows at a slight incline. This small change in elevation, combined with left side positioning, creates what sleep cardiologists call the optimal cardiac sleep posture. And for many seniors, implementing this change alone has led to measurable improvements in morning blood pressure readings, reduced nighttime arrhythmia episodes, and better overall sleep quality. Before we wrap up, I want to take a moment to highlight the warning signs that may indicate your sleep position has already been affecting your heart and that you need to speak to your doctor immediately. Do not ignore these symptoms. Waking up with shortness of breath, particularly if you need to sit up or stand to feel relief. This is a classic sign of nocturnal cardiac stress. Heart palpitations at night or upon waking, a fluttering, racing, or skipping sensation in the chest. Morning chest tightness or pressure, even mild or brief discomfort should be evaluated. Swollen ankles or feet in the morning, a sign of poor overnight circulation or early heart failure. Waking up with a headache. This can indicate nighttime oxygen desaturation related to sleep apnea, which directly stresses the heart. Chronic fatigue despite adequate sleep. If you're sleeping 7 to 8 hours and still waking up exhausted, your heart may be working too hard during the night. If you experience any of these symptoms regularly, please consult a cardiologist. Do not wait. Do not assume it's just aging. These are signals your body is sending, and they deserve to be taken seriously. Let's do a quick recap of everything we covered today. Number 1, sleeping on your right side shifts your heart, compresses major blood vessels, and increases the risk of arrhythmia, particularly for adults over 60. Number 2, sleeping flat on your back worsens sleep apnea, elevates blood pressure, and redistributes fluid dangerously in those with heart conditions. Number 3, the best sleep position for your heart is the left side, slightly elevated, supported by a wedge pillow or adjustable bed. Number 4, use a body pillow or back support to maintain your position through the night. Number 5, if you experience any nighttime cardiac symptoms, speak to your doctor. Early intervention saves lives. These are not dramatic changes. They don't require medication, they don't require surgery, they simply require awareness and a small adjustment to a habit you perform every single night. You've spent your whole life taking care of your responsibilities. Now it's time to take care of your heart. If this video helped you, please share it with someone you love who is over 60. It might be the most important thing you do for them today. Like this video, subscribe to our channel, and click the notification bell because we publish medically researched content like this every week. Take care of your heart. Good night.